Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, the highlights. 1 year after the first case of COVID-19, Africa remains the weeping child as the continent experiences a spike in cases. Compliance to COVID-19 protocols remain an issue. More states commend stiffer penalties for offenders. And South Africa seals deal with Johnson & Johnson for supply of coronavirus vaccines. President Cyril Ramaphosa explains decision to Parliament. Well, Nigeria approaches the anniversary of its first case on the 27th of February. Last night, 938 new confirmed cases and 8 deaths were recorded in the country, putting the country's confirmed cases at 143,516 cases. With over 1,000 new recoveries recorded across the country, the centre is reporting over 118,000 cases that have been discharged. The new cases are reported from 19 states and the Federal Capital Territory, with Lagos recording the highest, 236, the FCT 123, followed by Plateau 92 cases, Benue recorded 63 cases, Katsina 53, Oyo recorded 50, Osun State recorded 45. In Kaduna, it recorded 43 cases. A breakdown of the figures from Kaduna shows that 7 patients are due for discharge. 43 samples returned positive, out of which 478 were analyzed. And a breakdown from the Kaduna State shows the local governments with new cases are Kaduna North, Beningwari, Jaba, Lere, Zaria, and 1 each in Kaduna South, Kagako, Kaura, Makarfi, and Sabongari. However, 8 persons confirmed to have died of the coronavirus complications on Thursday, making it exactly 160 deaths recorded within the last 14 days, bringing the death toll to 1,710, which have been recorded in the 36 states and the FCT. So presently, according to the Africa Center for Disease Control, the continent has confirmed over 3.5 million cases, with recoveries nearing 3 million. We're looking at 2,990,890. Now, the WHO, the World Health Organization, is reporting that Africa's COVID-19 fatality rate rose to 3.7% during the last 1 month compared to 2.4% previously, and is now well above the global average as the number of deaths near 100,000 mark. Now, while the Presidential Task Force on COVID-19 announced officially Nigeria's second wave in December of 2020, Africa's second wave of cases was recorded to have begun in October of the same year, and according to WHO, seems to have peaked on the 6th of January 2021. Now, with the second wave spreading much faster than the first and far more lethal, Africa battles new, more contagious variants, some of which include variant 501YV2, also known as the B1351, first identified in South Africa, which has been detected in 8 African countries, while the second, the VO2 2020-1201 variant, also known as the B117, initially identified in the United Kingdom, has now been detected in 6 countries on the African continent. Well, as Africa continues to prepare and wait and gear up for its largest ever vaccination drive, new variants we hear are likely to emerge as the virus continues to spread, leaving the world with the preventive measures which must be maintained, and the vaccines are all crucial tools in the fight against the pandemic. Well, let's now hear from the World Health Organization Regional Director for Africa, Dr. Matshidiso Moeti, on the challenge before the continent in the fight against the coronavirus.
And so where were you before you moved here then?
Avec les enfants, leur poser des questions qu'est-ce qu'ils ont compris, qu'est-ce qu'ils n'ont pas compris, et apporter at least one time, and with for different reasons being insecurity.
Okay, merci.
Of communication. So here.
Well, Dr. Moti believes that the continent is seeing an increase in the number of deaths from COVID-19 due to some gaps in the management of the deadly disease. She's also saying that there are also disturbing warning signs that health workers and health systems in Africa are dangerously overstretched.
This pandemic in Africa, more than 3.7 million cases have been reported. And in the coming week, the continent is projected to pass a devastating marker of 100,000 lives sadly lost to this virus. Deaths from COVID-19 have increased by 40% in the last 28 days compared to the previous 28 days. The increasing deaths from COVID-19 are a tragic warning that health workers and health systems in many countries are dangerously overstretched. The one-year milestone comes as the continent faces the spread of new strains of virus. While a vaccine that protects against all forms of COVID-19 illness is our biggest hope, preventing severe cases and hospitalizations which overwhelm hospitals and health systems is crucial. Go out and get vaccinated when a vaccine becomes available in your country.
Dr. Chinwe Ochu is the Director of Prevention Programs and Knowledge Management, the department with the NCDC. She joins us from our Abuja studios. Welcome to the program.
Thank you very much, Millicent.
I'd like to begin by asking your assessment of the second wave in Africa, because according to the WHO, the rising deaths, overstretched healthcare systems, the lethal variants are all staring us in the face.
There is no doubt that the second wave has been more vicious than the first one, with Africa recording very high number of cases with this second wave. As a country in Nigeria, we've seen that increasing number of cases with the second wave. For instance, last year, week 26, when we had the peak of the first wave, we just had over 4,000 cases as the highest number of confirmed cases that we recorded on that week. But with this second wave, week 3, we recorded over 10,000 cases that week. So we have more cases. The second wave is more vicious. And like the WHO rep rightly pointed out, it could be as a result of the various variants of the virus that we have that have been shown to be more infectious than the original virus. And the country has not been spared. We've also been able to detect some variants of COVID-19, of the SARS-CoV-2 virus in the country. So a lot is dependent on trying to keep ourselves safe through the same preventive measures, because it's the same kind of preventive measures that protect you from one strain that will also protect from the other strains.
But would you say that there perhaps is good news already, because the WHO is saying that Africa peaked around the 6th of January 2021?
The WHO is reporting on the cumulative data for Africa, and their data could be pointing to that it's possible the continent peaked on that January 6th, the week of January 6th. But for us as a country, though we are seeing a slight dip in the number of cases, we are interpreting that very cautiously because we know there are multiple factors that could lead to a pseudo decline, so to say, in the number of cases. A lot depends on how much tests we are running, and then, of course, how we are also reporting. So we need several weeks from now to be able to say whether we have started going down that sustained slope of the other side of the second wave. It will be too early to make that assumption now. So we will continue to strengthen our public health interventions and keep hoping that very soon, especially as we continue to wait for the vaccine to be introduced in the country, it's more compelling now for us to stay safe until that happens and we're able to cover a good proportion of the populace that will give us that herd immunity.
Let's look at some of the measures the NCDC has been putting in place, and one is the patient's handbook for COVID-19 home-based care. First, we're looking at a book that is about 32 pages. Some people say it's a lot. Couldn't have been less, 10 pages or even less than that.
Millicent, that book is actually very user-friendly. It's colorful and the font size is good. Yes, what we are trying to do is to make sure that people have the information they need available to them. So we needed a comprehensive handbook that will cover all the thematic areas in home-based care for COVID-19 patients. So we have the various sections, and all the sections may not apply to a particular individual at the same time. We also have the table of contents that can guide you directly to the section of the book that you want to look up. And we are encouraging Nigerians to download this handbook. Is a very useful handbook to have. Even before you have a case to manage, it's good to get yourself familiar with the content of the book. Very interesting. You can finish it within 15 minutes. It tells us how we can manage cases that do not have symptoms and those that have just mild symptoms at home safely, using caregivers, designated caregivers, and how these caregivers can stay safe while managing these positive cases. Those who can be managed at home are those who have tested positive to COVID-19 through laboratory tests, but either they do not have symptoms or the symptoms they have are very mild, and they do not fall within the high-risk category, like those that are elderly, above the age of 60, or those with underlying comorbidities that could put their lives at risk. So this book is very, very useful and tells you what to do, how to self-isolate at home, and how you can take care of your loved one who has tested positive for the virus and manage that person until he comes out of the infectivity state. So it's a very important book that can be downloaded from our website on covid19.ncdc.gov.org. And you keep it handy at home and share with your friends.
Finally, Dr. Ochu, much of perhaps the success of home-based care really depends on the patient. What's your assessment of it so far?
I wouldn't really say it depends only on the patient. There are lots of key players in home-based care of a COVID-19 patient. You have the patient, you have the caregiver, you also have the relations that have a role to play in providing the moral and psychological support to the person on isolation. You have the state case management team that will carry out risk assessment to know whether this person needs to be managed at home or should be taken to a treatment center. And they also follow up in case there is deterioration in the state of health of the person, so they can quickly transfer the person to a treatment center. So we also have the public health officials and even the doctors themselves, the clinicians and healthcare workers that will eventually take over the management in case they have to move this person to a treatment center. So a lot of people have a role to play. The patient has a role to play by maintaining those strict public health measures of wearing face masks, proper hand and respiratory hygiene, keeping the environment safe. The caregiver has a role to play in knowing what to do to keep himself or herself safe, and that is why the handbook is very, very useful. Other members of the family also know what to do to make sure those that are negative remain negative, and those that are positive access treatment as early as possible. So it is a collective effort. Everyone in that home and even in the whole of the health system has a role to play in a successful home care management of COVID-19 patients.
All right, we appreciate your time on the program. Thank you, Dr. Chinwo Chu, Director, Prevention Programs and Knowledge Management, Department with the NCDC. Thank you for joining us on the program.
Thank you very much.
Since the outbreak of the COVID-19 and the directive of the Kwara State government to arrest violators, most residents appear not to be adhering to the non-pharmaceutical protocols. With most markets and motor parks guilty of this directive, the state's task force insists that more monitoring will be made on a regular basis and the flouters sanctioned.
In spite of the number of people testing positive and deaths being recorded in Kwara State due to COVID-19, many residents in Ilorin still do not abide by the protocol.
So far, we have recorded 50 deaths. That's quite unfortunate, but that is our reality, which is why we continue to urge our people to please adhere to all the safety protocols that the NCDC and Kwara State government have rolled out. Many of our people are complying, but we still have several people who still feel COVID-19 is a hoax.
At the popular Ekpata market, many buyers and sellers go about their business without face masks, and the issue of physical distancing seems non-existent. It's the same scenario at the Maraba Motor Park for passengers and transporters. This passenger believes most people are unconcerned.
I think that most of our people believe that the pandemic is over, and so we can continue to live our normal lives. Some are just tired of using it because, it's alien to us.
The chairman of the COVID-19 committee had on several occasions given directive for violators to be arrested, which the police say is being enforced regularly.
Following consultation with the leadership of the transport union, government hereby directs that Okada riders can only carry one person at a time. Taxi or cab drivers are to carry one person in front and maximum of 2 persons at the back at any particular time. The drivers and the passengers must wear their face mask appropriately. Defaulters will be arrested and prosecuted and on conviction be punished.
We've been arresting. Even the government went ahead, went a step by creating this mobile court where most of them were tried. And the directive still subsists now, and we are still arresting.
With the death of 50 persons in the state since the outbreak of COVID-19, the people are expected to abide by the protocols and flatten the curve.
German Chancellor Angela Merkel has defended the decision to extend Germany's lockdown until the 7th of March, telling Parliament that easing restrictions too early could lead to a rebound of the virus, warning that especially the newer mutations could destroy any success. Now, the country has been in some form of lockdown since the 2nd of November. Let's talk to Deutsche Welle correspondent Janelle Dumalao on the present situation. Hi, Janelle. Another lockdown extension. Is there an end in sight?
Indeed, we're at a point where lockdown fatigue is clearly setting in. It's cold, there's nothing to do, people are bored, they feel isolated. It has to be said, however, that the lockdowns really did help slow down infection, so that's the flip side of it. But what has happened now is that the goalpost for easing restrictions appear to have shifted. Before, the condition for easing restrictions was that we had to go down to 50 new cases per 100,000 people within a 7-day period. We're at 64 now, so really that's not far off. But now Merkel and her administration have changed the guidance. The new number is now 35 new cases per 100,000 people in 7 days. And the reason for that stricter guidance is fear over the new virus variants from Brazil, from South Africa, and from the UK. And until it can be certain that a third wave fueled by these more aggressive and more transmissible variants can be held off, we have to think of restrictions as remaining on the cards for now in Germany.
But there have also been fears of the virus mutations coming in from neighbours like Austria, which has since relaxed its own lockdown and seen a rise in cases of the South African variants. Will there be border closures?
That's a big concern. Of course, Germany is surrounded by 9 countries. What is bad for Europe from an infection perspective is bad for Germany. And in fact, border closures are already set to come into effect. The Eastern German state of Saxony is putting in place border controls with its neighbor, the Czech Republic, and that's set to take effect over the weekend. Same case with the southern German state of Bavaria and its neighbor, the Austrian state of Tyrol, which is an area famous for skiing. Now, Tyrol has been a source of irritation for the Bavarian local government for some days now, with the state's premier Markus Söder saying that Tyrol was not taking especially the South African variant of the virus seriously. And in fact, now the Austrian Chancellor Sebastian Kurz has said that Tyrol has the biggest outbreak of the South African coronavirus variant in Europe. Now, if you look back to the early days of the pandemic here in Europe, you'll remember that ski holidays were a big driver of the first wave. Fast forward to today, and there is a sense of frustration in the air, a sense that lessons have not been learned, and really recent history has repeated itself, this time with higher stakes and more infectious variants.
All right, DW correspondent Janelle, always a pleasure. Thank you for that update. And now, beating COVID-19 and accelerating economic recovery are part of the 4 focus areas of the South African government to steer the nation back to wellness, part of President Cyril Ramaphosa's presentation at this year's State of the Nation address. It was a much scaled-down event with only 50 people present in the parliamentary chambers, while many others joined the program via an online platform.
First, we must defeat the coronavirus pandemic. That is primary in everything that we have to do as a nation. And second, we must accelerate our economic recovery. Third, we must implement economic reforms to create sustainable jobs and drive inclusive growth. Finally, we must fight corruption and strengthen the state that has been weakened. The first phase of our vaccination program, which is targeted at health and other frontline workers, will now use the Johnson & Johnson vaccine, which has been shown to be effective against 501Y. We have secured 9 million doses of Johnson & Johnson vaccine. The first batch of some 80,000 doses will arrive in the country next week. Further consignments will arrive over the next 4 weeks, totaling 500,000 Johnson & Johnson vaccines.
South Africa's President Cyril Ramaphosa addressing Parliament there. Well, as we get into the weekend, continue to take responsibility. If you have symptoms associated with COVID-19, then please visit one of the sample collection sites in your state to get tested. Our website, channelstv.com, has more updates, also a better understanding of the pandemic, plus several other stories as well. That's the program this evening. Thank you for watching. I'm Millicent Wonka. Stay healthy.